Hello everyone, myself Dr. Aditya Gupta. One PYQ per day keeps FOMO away. Let's welcome back to the session. Today we'll be discussing about Turner syndrome and Noonan syndrome, a question that is almost, it's a guarantee that one question will be asked about either Turner syndrome or something related to Turner syndrome. It will either there at least in the option, so you should know about it. Now what is Turner syndrome? This is something which we know from our 11th standard, from our 12th standard, since we gave up pre-medical entrance examination. Turner syndrome is caused by XO. There is one X that is missing. And because one X that is missing, the females that are born, they have a certain set of phenotype, like they look in a certain way. That phenotype is there. What is that phenotype that is associated with Turner syndrome? They will be short statured, their height will be short. In fact, growth hormone therapy is recommended for females who have Turner syndrome. And in the level 3 examination, if you remember your growth and development, in the GHI there is a table. The level 3 includes doing a karyotype to rule out Turner syndrome for short stature. So they will have a short stature, they will have a webbed neck, and they will have cubitus valgus, where the carrying angle of your elbow joint will be increased. So this is what is known as a Turner phenotype. A short female, webbed neck, cystic hygroma, lymphedema, having streak gonads. This is what is known as a Turner syndrome phenotype. Turner phenotype. What is Noonan syndrome? The reason I wanted to make this video today is that a lot of people have a misconception that Noonan is nothing but male Turner. This is absolutely wrong concept. It is not male Turner. Noonan syndrome is having a Turner phenotype in either males or females. Females can also have Noonan syndrome. So when you have all these features of Turner syndrome, that you have webbed neck, you have short stature, you have this lymphedema and everything, that is a phenotype is there, but it is not caused because of this genotypic abnormality. It is not caused because of XO. Instead, it is caused because of an autosomal condition called PTPN11 mutation. Okay, it is caused by an autosomal condition called PTPN11 mutation. So you have two similar diseases. One is a Noonan syndrome and one is Turner syndrome. Turner syndrome is caused by XO. Noonan syndrome is caused by PTPN11. Both of them these two genotypes will result in a common phenotype that is called the Turner phenotype. Short stature, lymphedema, webbed neck, increased carrying angle. But since this is autosomal in nature, since Noonan is autosomal in nature, it can occur. It can occur in both males and females as well. Males and females both can have Noonan syndrome. So if they give you a male, 10-year-old male with short stature and webbed neck, the answer will obviously be Noonan syndrome. But if they give you a female with webbed neck and short stature, but they say that disease is being inherited in an autosomal manner, the answer again will be Noonan syndrome, because Noonan is nothing but Turner phenotype being inherited in an autosomal manner because of mutations of what? PTPN11. There's another difference that they most of the times give in the exam, that is in Turner syndrome, the cardiovascular defects that is associated with Turner syndrome we know is most commonly is bicuspid aortic valve. What it is bicuspid aortic valve, other coarctation of aorta, aortic stenosis, these things are also associated. Did you notice something common between these things? I said bicuspid aortic valve, I said coarctation of aorta, I said aortic stenosis. As far as Turner syndrome is concerned, when they have a cardiovascular defect, it's predominantly on the left side of the heart. That is, it predominantly affects the aortic side of the heart. While when the Noonan person who has Noonan syndrome, a person who has the Turner phenotype, ki webbed neck bhi hai, short stature bhi hai, when Noonan syndrome will have cardiac defects, it will be on the pulmonary side. They instead will have pulmonary stenosis. They instead might have tricuspid regurgitation. So they have cardiovascular defects on pulmonary side, while Turner has cardiovascular defects on the aortic side. Another previous year question that was asked was that basically revolved around, it asked which of the following is a correct statement, and the correct statement simply was, if you have webbed neck, then Turner syndrome. So Turner syndrome is certain proportion of females will not have webbed neck, certain will have webbed neck. If you have webbed neck in Turner syndrome, the cardiovascular defect probability increases. This is a simple association that they found as far as Turner syndrome is concerned, and this is one simple line that you need to remember. If a Turner syndrome female has webbed neck, cardiovascular deformities are more common. If she doesn't have webbed neck, the chance of getting a cardiovascular deformity is slightly less. So that's it from my side today. Hopefully I've understood the difference between Turner and Noonan syndrome. One PYQ per day, one PYQ topic per day. My goal with the help of this videos is that by the time INI-CT at least occurs, markers have covered entire pediatrics. And like I told you, थोड़ा सा और वेट कर लो, a PYQ only app is coming your way. App that helps you in doing just previous year questions ताकि तुम्हारी preparation reflexively best हो जाए. Thank you and have a nice day.